Medicare offers different options for you to get health care coverage. It's important to learn the basics so you can get the most out of your plan. Joining us today is Kathleen Donnelly, and Kathleen specializes in Medicare supplements, Medicare Advantage plans, and special needs plans. Welcome, Kathleen. Gosh, I think we get more questions about Medicare, and we've just been chatting off camera. You make it so simple. You make it so easy because people are presented with that, oh gosh, now I'm on Medicare. Do I need a supplement? Do I need an Advantage plan? What are all of these other Medicare, Medicaid, all of these terms? So basically, with your 30 years of experience, what can you tell us about navigating Medicare?
Well, first, thank you for having me. Medicare is the last insurance that you're going to have. So it's very important that you understand what you're getting, why you're getting it, and how it works. And it's important that you deal with someone that can be an advocate for you to help you navigate this complicated system.
And that's why we love to have folks in that are experts. You know, that you mentioned to me, you know, Medicare and all the different plans change every year. Mm-hmm. There's new benefits, there's benefits that aren't covered, things like that. And that's why we go to you rather than, you know, maybe our next door neighbor and ask questions.
Their needs may be different than your needs.
Absolutely. So what are the benefits of getting a secondary medical plan?
So Medicare is does not cover your benefits or does not cover your medical costs at 100%. It's actually an 80-20 plan, so you are responsible for 20% of the costs if you have original Medicare, and that's after you've met your Part A deductible and your Part B deductible. So you have a financial exposure, and what getting a secondary policy or a Medicare Advantage policy will reduce your financial exposure.
Right, and we're going to talk about those details in a moment, but I was looking up, you know, different terms for these plans. There's a dual special needs plan. Now, what's involved with that?
So a dual special needs plan is for our recipients that get both Medicare and state-funded Medicaid. So there's an income and asset test. If your income and your assets are below a certain amount, you can get a dual special need plan. And that will reduce your cost sharing. You can actually be eligible for no cost sharing at all, where you can get access to care and you don't have to pay anything for it.
Okay, and then there's the chronic conditions plan. That was another one.
So chronic condition plans are designed for people that have chronic conditions, such as diabetes, I think they say diabetes mellitus, cardiovascular disease, chronic heart failure, and in some cases COPD. And if you have one of those those conditions, then you can get on a chronic special needs plan and you get different services. You get some case management and things like that if you need it.
That are tailored specifically to that chronic condition.
For those specific needs.
Now, you know, different times of the year, those TV ads come on about Medicare supplements or Medicare Advantage plans. Mm-hmm. So, one, why are they just at certain times of the year? And also, maybe what's the benefit of one rather than the other, or the differences? So, Medicare Advantage, Medicare supplements.
Okay, so first of all, why do the ads come out when they come out? Typically, you'll start seeing those in September because on October 15th to December 7th, every Medicare recipient across the country has an opportunity to make an adjustment to their Part D prescription drug plan. Now, if your Part D prescription drug plan is connected to your Medicare Advantage plan, that puts your Medicare Advantage plan on the table. You can change that too. So these plans can change every year. The copays can change, the formularies can change. So you want to take a look. You want to have a plan review every year in October. And so all the companies are advertising because, of course, they all want you to join them. The other thing is we have the Medicare supplements and the Medicare Advantage. A Medicare supplement is where you keep original Medicare as your primary, and you have the supplement will pick up where Medicare leaves off. You're going to pay a premium for that. So the way I typically say is, do you want to pay up front and little to nothing when you use it? Because you'll have very little, if any, out of pocket when you go to the doctor. Does not come with drug coverage though. Or a Medicare Advantage plan where you have typically a zero premium, but you pay copays when you use it, and your Medicare does not pay your claims. The health insurance company does.
And so that's why we come to folks like you, Kathleen, to make it as simple and make it as easy as possible to navigate through Medicare. So thanks again for being here, and what great information. So if you have more questions or need some advice on Medicare plans, don't forget to contact Kathleen at the information on your screen. Thanks so much again.
Thank you. It was a pleasure being here.